Hi everyone, I'm Ursula Carroll and I chose to do my master's thesis on syphilis. Currently, Louisiana ranks number one in the number of STD cases per year. In reports from 2015, Shreveport-Bossier had the most syphilis cases in the state. These numbers are the reasons why I chose this topic. Because I am from this area and would potentially practice here one day, I thought it would be beneficial for me to educate myself on something I had a good chance of seeing in future patients. In this presentation, we will discuss presenting symptoms, diagnosis, treatment, and prevention of syphilis. Syphilis is caused by a gram-negative organism called Treponema pallidum. Syphilis is contracted through direct contact with a syphilitic sore through vaginal, anal, or oral intercourse. Congenital syphilis is when the disease is passed from the infected mother to the fetus through the placenta or transmission of the disease during delivery as the neonate passes through the infected birth canal. As mentioned earlier, the number of syphilis cases has increased in Louisiana. Syphilis cases have also increased throughout the United States. The number of individuals diagnosed with syphilis has increased every year since 2001. Unprotected sexual intercourse, having multiple sex partners, homosexual men, and having a positive HIV status are the main risk factors for contracting syphilis. Syphilis occurs in different stages. In primary syphilis, the main symptom is a painless canker sore. Because the sore is painless, it often goes unnoticed. Individuals who present in this stage should receive a pelvic, genital, rectal, and oral exam. If the individual does not receive treatment, the canker sore will heal on its own and the infected individual will eventually develop secondary syphilis. Common systemic symptoms such as fever, headache, and muscle aches can occur in secondary syphilis, but the classic diffuse macular-papular rash on the palms of hands and soles of feet is what usually triggers an individual to present for testing and treatment. Individuals who present in this stage should receive the exams of primary syphilis as well as skin, hair, and musculoskeletal exams. Like primary syphilis, secondary syphilis can also resolve spontaneously without treatment. This puts infected individuals at risk for developing tertiary syphilis. Tertiary syphilis symptoms are more life-threatening. Cardiovascular manifestations including aortic dilation and aortic valvular regurgitation. Central nervous system manifestations include general paresis and altered mental status. Granulomas can form on the skin, bones, and viscera of internal organs. In patients with tertiary syphilis, they warrant a full workup with the exams listed previously as well as a cardiology and neurology consult. Individuals presenting with syphilis symptoms or who want to know their status can be screened by using these lab tests. A rapid plasma reagent, also known as a RPR, or a venereal disease research laboratory, also known as the VDRL. If either of these tests come back positive, the presence of the infection can be confirmed using tests that are highly specific for syphilis and detect antibodies that target Treponema pallidum. The fluorescent treponemal antibody absorption test is most commonly used. It is recommended for all patients diagnosed with syphilis to also be tested for HIV because of their high occurrence of co-infection. Individuals with primary and secondary syphilis can be treated with one dose of 2.4 million units of benzathine penicillin G intramuscularly. If an individual is allergic to penicillin, they can take 100 milligrams of doxycycline orally twice a day for 2 weeks, 500 milligrams of tetracycline orally 4 times a day for 2 weeks, or 1 gram of ceftriaxone daily for 8 to 10 days. Individuals with tertiary syphilis are treated with 3 doses of 2.4 million units of benzathine penicillin G intramuscularly, with each dose being 1 week apart. Patients with tertiary syphilis who cannot take penicillin can take 100 milligrams of doxycycline orally twice a day for 4 weeks, or 500 milligrams of tetracycline orally for 4 weeks. Educating individuals to practice safe sex, such as being abstinent, being in a monogamous relationship, and using latex condoms are all preventative measures to reduce acquiring and spreading the infection. There are community health centers and outreach facilities that will provide screening for syphilis. Knowing your status and your partner's status, as well as being treated correctly by the provider, are all important in preventing syphilis. It is also important for providers to stress to their patients that have tested positive for syphilis to inform anyone they have had sexual intercourse with so they can also receive the proper testing and treatment. If your patient's partner or partners cannot present for treatment, then it is appropriate and legal for you as their provider to write prescriptions for these individuals without seeing them. In August 2006, the CDC recommended expedited partner therapy, known as EPT, in certain populations, including in sexually transmitted diseases such as syphilis. Thank you guys for watching my PowerPoint presentation. I hope you learned a little bit more about syphilis and the correct way to educate and treat your patient of this infection. Thank you.